Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Susannah Eastwick. She is the director of a physician MBA program. Today's Kevin MD article is Advancing Healthcare Through Physician Leadership, 5 Skills for Changing Healthcare. Susannah, welcome to the show.
Thank you so much for having me. I'm super excited to be here talking with you and your audience.
All right. So tell us a little bit about yourself and then the article that you wrote on Kevin MD.
Yeah, so I am Susannah Eastwick. I serve as the director of the physician MBA program at the top-ranked Kelley School of Business at Indiana University, and I bring a passion for how we leverage education to create change across whatever platform. And currently, my passion, of course, is how we use education to create physician leadership that transforms the healthcare industry. And the article that I wrote is really about the skills that the MBA curriculum provides to physician leaders, but it's really the inherent skills that as physicians build them, they can use them to help transform the healthcare industry into ultimately not just what it could be, but what it should be in terms of an environment where patients are at the focus.
All right. So we have a lot of physicians who are interested in going into leadership. One of the common issues that we face is that physicians are losing their autonomy, right? They're getting burnt out because of that loss of autonomy, and they want to go into physician leadership and, of course, look for programs like the ones that you run. So before talking about the article and some of the skills that physician leaders need, tell us about the physicians that apply to your program in the first place. Tell us what kind of attributes do they have?
Yeah. So you said something that is incredibly passionate for us. The physicians are losing their voice, right? And that's increasing burnout rates, that's decreasing engagement, all of those things. And so ultimately, what we try to do is not just teach physicians how to leverage their voice, but also how to use the language effectively to change healthcare. So the best physicians who come to our program, which is, of course, Kelley School is one of the top 20 business schools in the US, the physicians who come are really change agents. They're emerging change agents in their own right, who then want to use the knowledge, skills, and tools of a training program like ours, right? Because an MBA program is ultimately just a strategic training tool. It's never going to give you the depth and breadth of knowledge that a clinical education would give, but it's really that supplement to, okay, you understand patient care, so how do we teach you the language of business to use those principles to transform the healthcare industry? And so ultimately, physicians who come to us are those emerging change agents who then graduate to become effective change agents across the industry. And our almost, more than a decade experience in that, we have produced, I wouldn't say produced, that's not necessarily the right word. We've partnered with physicians who now have gone on and created incredible change across the industry. And the stories are endless that I'd be happy to share.
And it goes without saying that healthcare is more dominated by corporate entities, right? The number of private practice physicians, I think the numbers are less than 20%, and they're going down by year after year. Now,
Yeah.
how important is that language of business, as you said earlier, that business vernacular? How important is that for physicians to gain a step hold into that leadership role?
Right. Well, Kevin, in a perfect world, we would have all of our healthcare leaders get clinical education, right? Be MDs, and that's not efficient. And so the best way for us to essentially provide that fix to the lack of voice of advocacy for patient care in there is to give physicians the degrees, education, language that the current healthcare administrators have, right? So less than 5% of hospital CEOs are physicians, which is just tragic, right? And the fact that what is it, 78% of physicians now are employed physicians, what you just said. So that piece, the only way really to bridge that gap that is in healthcare, right? The administrator who stands at the front of the room and puts up the big fancy spreadsheet and says, well, we need your dashboard and your metrics to match these without ever giving the why. But also what we had this physician who came into the program, and she was the chief of staff when she first started the program. And she confessed that she would sit at the back of the meetings, the back of the room in the meetings with her laptop open, and she would Google the phrases and terms that the administration was using because she didn't fully understand the language language. And by the end of the MBA program, she was in the front row and she was asking questions that they did not appreciate, because what she found out is sort of as she learned the language and the curtain got pulled back, with the wizard behind the curtain, the language was just being used as a way to sort of obfuscate the conversation, to keep people from asking the right questions because they didn't understand the concepts, right? And so by the end, she was in the front room and they were sort of like, you have to come to this meeting, because she would break down the conversation to be, let's talk about the core. And for us, our passion is really, for physicians, you best understand patient care. So why are you not the ones driving the conversation? And the problem is there's a language gap, right? So the more you learn that language, the more effective you can be in an environment where it's being run in corporate environment, right? It's a business rather than a service.
In your Kevin MD article, you talk about 5 skills that physician leaders need. So tell us about your article and tell us about those skills.
Yeah, so we're really hitting quite a bit on the first one, speaking the language of business, and that can really create transformation for any physician moving into leadership. And there's lots of ways to learn the language of business. It's not necessarily an MBA program. There's a plethora of ways, obviously. Then secondly is how the money works. And in fact, one of our professors, he teaches rules of the language, rules of money. And one of his first rules is it's always about the money. And then rule number 2 is follow the money, right?
Mm-hmm.
So if you don't know how the money works, how do you know how the decisions are being made, right? And so much of healthcare right now, and change is one big constant in all industries, but it's a very big constant in healthcare right now. So as you're looking at change, how is the money working? How do you get patient care? How do you get the quality you're looking for? That skill is absolutely necessary for navigating the current environment. Then how to improve processes and operations for patients. The Affordable Care Act was a big disruptor to the healthcare industry, right? And that's when we started this MBA program. But since then, all the things that keep happening, all it keeps exposing, especially COVID, is that we don't have the operations and the processes in place that allow us to be successful. And it's not just low-hanging fruit. It's sort of like watermelons on the ground of how you can use, this big word we keep talking about, efficiency. But when you times and challenge, all the things that challenge the process for a patient to get care, they're the same processes that frustrate physicians, right? We're talking about burnout happening with EMR processes being so onerous. Any way you can look at creating efficiency and excellence and quality in the process, that's where you can really transform. And so that's a skill that all physicians need to gain. Then how to that piece, and you've had articles on this just recently too, that piece of emotional intelligence, really learning the skills around executive leadership. So being comfortable with conflict, physicians by your nature, you're not a big fan of conflict, right? You're there to take care of people. And so the conflict is not a place where a lot of physicians are very comfortable, but actually conflict can be incredibly productive. It's actually more a problem-solving tool on how you get the outcomes you're looking for, rather than something to be avoided. And so learning that skill of how do you negotiate, how do you collaborate, how do you leverage relationships to drive the outcomes you're looking for systemically, right? Because every physician has an incredible impact on that one-to-one relationship, but how do you take that impact and take it 1,000 to 1, 10,000 to 1, right? And that's looking at processes, procedures, and then how you leverage people to get the outcomes that you're looking for through the relationships, which really gets at that executive skills, communication, conflict, negotiation, collaboration, et cetera, which hits at that emotional intelligence that's so hard to find, but really that's the skill we're all looking to build. And then lastly, it's how you advocate for patients in the healthcare system. Often we ask when we're starting programs, and we do not just an MBA program, but we do partnerships with healthcare systems and so forth and so on. So we educate physicians at many different levels and layers. And one of the first questions we always ask is, what are you most frustrated about right now? And the answer we get is trying to navigate the insurance world, right? How do I get care for my patients to get them not just access, but quality, right? And how do I get it paid for? And so that piece of advocacy can be at the micro level, the one-to-one level, all the way up to the national level, right? We can attest, I just said change is one big
Yeah.
constant, but we have a course that takes physicians to Washington, D.C. for 5 days and immerse them in the language of healthcare policy.
Hmm.
And it's really sort of how the sausage is made. And what you find out is there's very little physician voice in the advocate in healthcare policy, right? The pharma is very organized. Nurses are very organized, right? But physicians are not joined together in one voice. They're very splintered in their different healthcare associations, which, orthopedic surgery is very effective at being a lobbyist, but is internal medicine as effective, right? You
Yeah.
start to question how each of those. And so really becoming a strong advocate on whatever level that means to you is one of the skills that really continues to further patient care, but also in this environment of change, that's where the physician voice can better be inserted to create most effective change. So those are the 5 things that my article walked through.
Now, you mentioned earlier that there are many, many stories of physicians who went through your program and then went back and made a huge difference. So, just share a particularly poignant story about how some of these skills really influence one of those physicians to move the needle going back.
Yeah, someone who I'm immediately thinking of is a female physician leader who's in the southern part of California. She is the CEO of an FQHC that primarily works with low income, very marginalized population close to the border there with Mexico. And so it's a lot of people who are working in agriculture and other service based industries. And for her, when she took over the FQHC, it was in the red and in the red in the millions of dollars. And so she actually became the CEO while she was in the MBA program and started running. We essentially became her business incubator in a lot
Yeah.
of ways. So she started running the staffing, the process, the financials, everything through the program. And within 2 years, she has the FQHC in the plus in terms of the financial performance, but also has increased access. She has higher numbers of patients, lowered her wait times across the board, and her community relationship, which is so key, right? Because so much of what a physician does in whatever role it is really the community impact. It has been embraced to where the community sees that as one of the major resources for the entire community. So that's the one that first comes to mind, but I can probably scroll through, we bring through a cohort of about 40 physicians every year, and in every group there's a story of inspiration. And it could just be, for example, one of our graduates reorganized the urology clinic at
Mhm.
the VA hospital where he was heading the urology department. And he just worked on one specific procedure. And by fixing how the clinic was organized and how quickly the process moved through, cutting out things that were, causing, log jams or what have you, and slowing people down the process, he decreased the wait time for a veteran to get this specific urology procedure by 68%. I mean,
Mhm.
it is just, and that's, talk about cost savings and et cetera, right? Those impacts have sort of that wave effect throughout the industry.
Now, whenever the topic of physician leadership comes up on this podcast, I always ask my guests, is an MBA necessary? I understand that you're
Mhm.
looking through this through a certain perspective. So let me
Sure.
ask you, like for physicians who, like you said, can sometimes get that business vernacular, not
Mhm.
necessarily in an MBA program,
Mhm.
when should they consider a formal MBA program like yours?
Yeah. So great question. And you're going to find that, of course, I'm going to be biased, right? Because that's my role. I'm passionate about how education transforms anyone and their trajectory in the world. But I hear from our alumni that getting the training that they got through us helps them fall back in love with medicine, which is so incredibly inspiring. And then I also hear from our alumni that I should have done this years ago. And that's the
Mhm.
common theme, even if, our average age is about 45, but we'll have some people who are, a few years out of residency and they say the same thing. But I also want to be really cognizant of like some of our most successful physician leaders who are making large impact don't necessarily have an MBA. And so there's that piece of the self-awareness, right, that is so key in great leaders. But also you can walk through Adam John Grant's, latest books that he's recommended. Follow your blog for so many fantastic concepts that are being discussed, so many different educators who are out there trying to create impact through their knowledge, disseminating knowledge, that you can get that information in lots of different ways. The reason people are attracted to an MBA is not much different than how you were trained as a physician. It is a structured program with the pinnacle of knowledge of what you most need to know. And so there's that organized approach. And a lot of people talk to me about that. Like, sure, I could learn this on my own. I could teach this to myself. I could be in LinkedIn Learning, having a great time. But the structure and the organization, and the other thing that that an MBA program can give you that you can never get on your own in whatever capacity you start to learn the language of business, is the networking piece.
Sure.
And our alumni constantly learn from each other, leverage those connections to either hire one another or continue to learn in the environment. As they spent through COVID, they actually turned to one another constantly to be like, okay, you GI doc in Maine, I'm a plastic surgeon in California. How are we getting through this together? What processes are you using? What's working best? And so that peer learning piece is also a benefit of coming into a structured program like an MBA. Does that help answer the question?
Absolutely. And for those physicians who may be thinking of going through a formal MBA program, just give us an idea of the time and financial commitment it may take.
Yeah, and I'm a big advocate of do the research and find a program that works best for you. Not every program is, there you can. I had a boss once who joked like you could swing a dead cat and hit an MBA program every time.
Yeah.
They're everywhere, right? So what I say is when you're looking at MBA programs, there's four things to look at: who's in the classroom with you, who's teaching the courses to you, what are the classes, and then what's the modality and time commitment. And that's really a big one for physicians because your time is your most precious commodity. And so finding a program that makes an efficient use of time. And so looking at those four things, you'll find who's in the classroom with you, what are you going to learn from them, and what's
Mhm.
important to you. Most physicians are never leaving healthcare, right? So why would you go in a program with, all kinds of different industries? Your faculty should be a long-term resource to you in terms of consultants that you can call. Our finance professor continues to regularly get spreadsheets of different business plans and business ideas that physicians are working on, whether it be inside their organization or outside their organization. And so they say, hey, can you check out my financials? And so your faculty should become a consultant to you. And then thirdly, modality. This is the big question.
Yeah.
Are you looking for an online MBA, an in-person, et cetera? We're the best of both worlds. We're hybrid. So we're 70% online and 30% in person. So we keep that piece of the laying of hands, which research studies have been done on how do you deliver CMEs effectively for the long-term retention of knowledge in physicians. And what they've found is you've got to apply what you're learning if you want to retain that long-term. And so our in-person component is really that laying of hands application moment where we ensure that you're retaining and learning that language and practicing it. But our online environment, of course, we're the number one ranked online MBA in the country and have been for more than a decade. So you study online with us in confidence. And that length of time is really a key piece. Some people want to go really short, which that's challenging for physicians because you like to understand your
Sure.
scientists on a certain level. So we're a 21-month, 51 credit hour program. It's a full MBA, but delivered in a style that works best. But again, that's not necessarily what most, some people are just looking to get done quickly. So we're what we consider to be the best, right, of all the ways in which you can deliver business education to physicians. But, as you do your research, you can find a lot of different options out there.
And in terms of the physicians who may be considering a formal MBA program, tell me
Mhm.
the types of questions they need to ask themselves to see whether that's right for them. Are they already physicians in the C-suite? Are they physicians who are purely in clinical and thinking about
Mhm.
perhaps an executive role? Tell me the type of physicians where your program may be right for them.
Yeah. So the answer is actually all of the above. For us, we want to partner with physicians who want to be more effective in whatever way they want to be in the change that's coming across healthcare. And so about a third of our cohort are actually full-time practicing physicians. Another third are sort of what you might say, 1 foot practicing, 1 foot in some kind of administrative role. And then the final third are what you would call a full-time administrator. So in the C-suite, et cetera, or department chair in academic medicine, or on the payer side and the VP role. We really pull from across the industry. But what I would say is, a good MBA program wants to partner with a physician. What they should know before they get started is just what do they, that awareness of what they don't know and how a structured educational program can help you learn more about what you don't know, which ultimately also exposes how much more you will never know, right? But it's that moment of when a physician's thinking, okay, I'm feeling burned out. I'm feeling completely disempowered. I disenfranchised. And that rather than trying to find the early retirement button, I want to be part of the change that needs to happen in healthcare. And so that's where looking at an MBA program and saying, what can it help give me? And a lot of physicians think, well, I have to know exactly what I'm going to do with this, right? Because when you go to medical school, you have the immediate answer, right? I'm going to go on, I'm going to pick my specialty, then I'm going to go on to residency, potentially fellowship, and then I'm hired straight out of it. And an MBA is a lot more nebulous. And so you don't actually have to know how you're going to use it. A good MBA program should help you figure that out as you get exposed to the content. It should help you see, oh my gosh, like we have a physician graduating this year who came through the Air Force. He's an orthopedic surgeon, was working in a healthcare system, and he very quickly through the program realized he had a massive passion for operations and really looking at process improvement. And now he's gotten a job working in that exact area as a consultant. And he didn't walk in the door assuming that was going to be his outcome, but through the program learned this is really where I have a skill set. And so I would caution to your listeners and readers, like you don't have to know the answer.
Sure.
A good program should help you find that. You just have to have that passion to say, I'm going to use this opportunity to learn more and to help be more in the role that I'm in.
We're talking to Susannah Eastwick. She's the director of a physician MBA program. Today's Kevin MD article is Advancing Healthcare Through Physician Leadership, 5 Skills for Changing Healthcare. Susannah, let's end with some take-home messages that you want to leave with the Kevin MD audience.
I would say my first take-home message is that physicians are an incredibly inspiring group. I have the best job. I get to work with incredibly passionate and intelligent people. And so I would say if you are thinking about how you use your voice, how you become more effective, continue this education that you do by reading Kevin MD, which is full of great content. I'd love to talk to anyone who's thinking about how they can use a partnership with a good educational program to help create the change that they're looking for.
Susannah, thank you so much for sharing your perspective and insight. And thanks again for coming on the show.
Thanks so much for having me. This was great.